Let's react to Brett Maverick's video. I went to Turkey for another hair transplant.
2 years ago, I went to Turkey to get a hair transplant.
I'm pretty sure I reacted to that video. And Brett commented, which was pretty cool. Seems like a nice guy.
This time for my girlfriend's dad, Ryan.
Oh wait, it's not even for him? He's hooking up his girlfriend's dad. That's pretty cool.
After a 13-hour flight and some mid-airplane food, the three of us met in Istanbul.
Jingle them bells and frolic. Oh.
So as you guys know, I got a hair transplant a couple years ago. I thought it went great. I like my results. Ryan, he's a great looking guy, but I thought he'd be unstoppable with a full head of hair.
He's getting some points here with his potential future father-in-law. I like it. So it looks like the gentleman here has pronounced frontotemporal recession. He has a weakened forelock as well, and the temples have also receded back. So we'll see what they end up offering him.
All right, guys. So I am here with my girlfriend Chloe's father, Ryan.
Hello.
Say hi to the people.
Hey, everybody.
How are you feeling?
Hi, Ryan.
Are you excited?
Yeah, very excited.
I mean, he looks super youthful. This is great.
Maybe a little bit nervous, just as you would be for any procedure, but
Yeah, it is a, invasive procedure. So
Sure.
That's totally natural. So when did you first start noticing thinning?
I would say in my late 20s, early 30s, I started noticing. Yeah, late 20s, I would say.
Yeah, some people start noticing hair loss in their teenage years, and those patients are more likely to lose a more significant amount of their hair earlier in life. So when you start losing hair in your late 20s, 30s, that's already somewhat protective for hopefully retaining some more hair than just, turning into a Norwood 7. So this gentleman, you can see, has still, I can't really tell on his crown or mid-scalp yet, but you can see he has some hair back there, and he also has a forelock as well. So that's still pretty good.
I guess I didn't. I guess I kind of just figured, well, this is what's going to happen,
And a lot of people in those years are just trying to build their careers, and they're not necessarily focused on preventing further hair loss. And then at some point you've lost so much hair that it's sometimes hard to rebuild things. And so it's always good earlier in life to go on some preventative treatments. And that's why we talk about minoxidil finasteride so much, because we care about people not losing more hair and not having to rely on surgery later in life to try to bring some of that back.
But then after, seeing your results and talking to you about it, it seemed like, oh, that's actually a thing that does work and is for real. So
hair transplants are for real.
So how do you kind of felt like you gave up? Did you kind of lose hope? You're like,
absolutely, yeah.
Not gonna
Absolutely. The woman that cuts my hair, we've already had a talk. In a couple of years, I probably won't be coming to you anymore, so I'll just shave my head.
Yeah, some people are just very quick to sometimes shave their head, and they don't even consider all of their options. I think it's good to at least consider a hair transplant if you're even remotely a candidate, and it's good to talk to a hair transplant surgeon or a few to see what your options are. And even if you ultimately decide to shave your head, at least you know what all your options are, so you can make an informed decision. That's what it's all about. Yeah, that's the thing. So now we're seeing the clear crown loss that he has and mid-scalp loss as well. And he's exactly right. Some people have more ground to cover. So the density that can be created is sometimes not quite as tight or dense as what we would see in someone who has a little bit of frontotemporal loss or a lot of hair, and we're just trying to say lower the hairline by a little bit like Brett had, and really stuffing that area with lots and lots of grafts. When you're working on these larger areas, you need to be smart about how you allocate resources, finite resources from the back and sides of the scalp. And sometimes also there's body hair transplants, fine, but our primary source is going to be the back and the sides of the scalp. So you need to be very careful not to deplete all of that supply in a single surgery. In my opinion, it's good to leave some for the future to see how things grow out after, say, a single surgery. But even with these larger giga sessions or mega sessions, you have to be very careful about performing that properly. But even so, the density that you can create in multiple areas is not going to be quite the same as when you just work into some small area that is experiencing some loss. So this gentleman has a very nice donor supply. You can just see how dense it is in the back and sides of his head. So that is good in terms of like being able to harvest hopefully a large number of grafts, and that should really create a nice change for him. Patients in his shoes, I would still recommend medical therapy, especially finasteride, because some of the hair in that donor zone is still going to be DHT sensitive, and if you've transplanted it, now it can fall out in one of the recipient areas. So it's good to still preserve as much hair as possible, even when you're a little bit older.
For Ryan, they decided to extract 4,800 grafts from the back of his head and his beard to implant on his crown and hairline.
800 from beard. Careful on the back head.
So the thing is, when you visit some clinics, they're looking to get as much as possible in a single day's worth of surgery. Sometimes they might do back-to-back days, but oftentimes they're trying to maximize everything in a single day. And I get asked that sometimes, like, well, how come you're not doing, 4,000, 5,000 grafts in a single session? My stance on it is that it's usually better healing if I separate them out into 2 surgeries rather than do them on the same day, for example, or even back-to-back days. But again, it depends on the comfort level of the clinic and the surgeon. And also, these are very long days. So, kudos to clinics that can manage 5,000 grafts in a single day. But in my opinion, it's always safer to go for somewhat smaller procedures that are still impactful, and you can just repeat it again in the future if you're happy with the initial procedure. If you're unhappy with a very large surgery, well, then you're in more trouble because now you have that limited donor supply, and it's not like we have cloning yet, so you can't just make new grafts. So it's always going to be riskier going for one of these very, very large sessions than to break them up into smaller sessions, but we're not talking about like a couple hundred grafts. We're still talking about thousands of grafts. But there's still controversy, I would say, on how big a procedure should be. But most clinics around the world that are doing hair on a regular basis feel comfortable and feel that it's safe to do up to about 3,000 grafts in a day.
We will not touch this area already. And we have 48. We have chest 4,800. It's very big now.
He explained that the DHI transplant technique they use is the newest and most advanced available. We all felt really good about that.
So we have a video on a DHI technique, and all that is referring to is implanter pens, and basically the pens are loaded with grafts, and that's what's inserted into the scalp, as opposed to pre-made sites the way that I perform it in my practice and the way that it's done in many practices around the world. There are different techniques. There's nothing better or worse with DHI. It's just yet another technique that is used to implant grafts. Now, that's very different from the donor harvesting. That's still done, like I'm sure it will be in this gentleman, with FUE technique in most clinics these days. Some people still do FUT strip, but many, especially in Turkey, have moved to FUE technique. But you cannot say that DHI is better than FUE, because one refers to donor harvesting, which is FUE, and one refers to the implantation technique, which is, in, I guess, the way they're going to do it, DHI. So make sure to check out our video on that distinction, because it's often used to just like sell people on some new technique without much of an explanation. And what I wanted to point out is that it looks like they're trying to push the temple forward a little bit, and they're doing some degree of rounding into the hairline itself and moving it towards the forelock, keeping it at a similar height to where he has his hair now, which I think is appropriate, and working to fill in the frontotemporal corners. And here you see the crown marked out as well, because that's yet another area that they'll be targeting. What I like to do for the crown is to create essentially 2 separate shapes. The outer shape, which is the full area that we're going to work into for the crown, and an inner shape or an inner circle that focuses on the most bare area. And I try to basically increase my density in the epicenter of the crown, but making sure that I'm able to fill the entire crown. But I try not to equilibrate the densities if the epicenter of the crown is quite bare, like in his case. So I usually like to have another inner circle, and we'll show that here on the side just so you guys can see how I typically mark out a crown.
They then took pictures of the newly drawn hair design for them to reference the next day, and then they sent us on our way to enjoy the rest of the day.
Oh, interesting. So they drew and marked everything out the day before, and I guess they probably instructed him not to erase the markings and then show up the next day. The only thing is, if you're walking around town and you're sweating, then you're coming in for surgery with markings, but maybe not the cleanest scalp. So I don't know. I like to mark the morning of surgery, but this is yet another way to do things. Some people actually even make their sites the day before surgery. And when I tell that to patients, they get surprised that that's like a technique. But there are some clinics that will even do that. So lots of different ways to perform hair transplant surgeries. And one method isn't always better than another, but there are surely ways of doing things incorrectly.
Very excited.
Are you nervous about anything? Do you have any concerns or anything like that? Or are you just like, let's do this?
Yeah, I mean, really, I'm like, let's do this. Again, like I said, the same concerns as I would have if I was getting a tooth pulled at the dentist or something.
Like
you know?
maybe some pain and like
Yeah.
the recovery maybe.
Well, yeah, and just like, I mean, I'm the guy that is going to have a little bit of anxiety regarding any procedure.
Yeah, there's always going to be some nerves involved with these procedures, and we often give Ambien and Valium, and that takes the edge off. But it's normal for people to show up, a bit apprehensive about their decision to have the surgery and also how the day will go. So you see what they've done here is that they've shaved just his donor area, and it looks like they left him with the rest. Now, some people like this look. Some people prefer to just let us shave the entire head. And some people want to have a no-shave approach. Now, that can be done for usually a smaller number of grafts. I mean, they're shooting for, 4,000 grafts from the back of the head. So it's very difficult to do that without shaving. For smaller procedures up to about 1,600 grafts, we'll sometimes offer a no shave at the donor as well. And then it looks like almost like nothing happened, and we'll show a little clip here of an example of how the back of someone's head looks after we're done with a no shave. But for larger cases, we pretty much have to shave at least the back. So it looks like they're setting him up with an IV, and that could be for just general hydration, like just, having some saline running through so he doesn't get dehydrated. But it can also be because maybe they're planning to run some medications through that IV. Now, we don't routinely do that for our hair transplants. Most patients do not get IVs, and we just use oral sedation for people who want that. And patients can actually, drink water to stay hydrated as well. So this is not the only way to do it, but this is one way. But remember, anytime you have an IV, you have to make sure that people are being properly monitored, especially if you're giving some IV sedation through that IV.
Well, and I just got done procedure. You could see.
So it looks like they ended up just shaving his whole head. So I don't know. Initially, it wasn't fully shaved, and then now it is. I mean, it's possible that for maybe the recipient site making, they wanted to keep the hair longer, and then ultimately shaved it down anyway. But I don't know. This is just how they sequenced it. For us, if the patient is okay with a full shave, once I'm done with the markings, initially at the start of the day, I like to mark with long hair. But then if we've decided collectively to shave the whole head, then we'll just shave the whole head. And then, they'll just have that look for the rest of the day. And then, of course, into recovery. The other thing is these bandages. So some clinics love these bandages to just apply pressure. We feel that as long as we apply pressure over the course of the day, at the end of the day, there's no active bleeding. So we like to send patients out without any bandage, because if you remove the bandage at home or in the hotel room and you have bleeding because you took a scab off, well, then that might be a bit scary for patients. So we just prefer to send them out with no bandage, and they still do great. In the first 24 hours, you might have a little bit of spotting onto like a pillowcase from the back, but, eventually it dries up and it's really not a big deal. But you don't have significant bleeding from removing a scab. So that's the benefit of no bandage, but the bandage works as well. The other thing is he's got crown work that they did, so that's going to be pretty close to where this bandage lives. So as he removes the bandage, he has to be really careful not to affect the crown grafts.
It went really well and surprisingly hurt a lot less than I kind of went in there expecting. Yeah, I'm really pumped about it.
Hey.
How's it going?
Looking good.
All right, look at that.
Check that out. How's it feel?
Feels good. I think the local anesthesia is wearing off, but it's not like excruciating or anything. It's just mildly irritating, I guess, maybe.
A little bit painful.
Just a
little bit of sting.
Yeah, usually in the first day, people report like a headache more than anything else. It's usually not a sharp pain. It's usually just kind of an overall kind of dull ache. And usually Tylenol can help with that. We also give some stronger painkillers like Percocet, and that can, of course, take the edge off as well.
It's still not as bad as a sunburn.
Yeah.
So, yeah.
So tell me about it. How'd it feel?
It was so interesting. Everyone that worked there was really cool. They had a series of translators come in if there was any sort of language barrier. And I would say probably the most painful part of the whole thing was the first couple of anesthetic shots. But no more than if you have like dental work done or any sort of procedure.
There are ways to minimize the discomfort felt from the local anesthesia shots. One way is to use smaller needles, of course. Another way is to inject slowly. You also want to use the smallest quantity necessary to get the patient numb. And sometimes a vibration tool can be helpful to trick the brain so it's less focused on the pain itself.
You had most of the hairs transplanted from the back, but also some from the beard, right?
Correct.
When you're working with beard hair, you don't want to necessarily put that hair right at the hairline, but it could work well when intermixed with other scalp hair, and especially if it's being used for further back, like into the crown. I usually don't offer beard harvesting with an initial procedure. I mean, there is always some added risk to working down here in the neck, so I'll usually reserve using the neck as a donor area until maybe the patient's had 2 or 3 scalp procedures, and then we might go into the neck. But 800 grafts from the neck in a single session is pretty standard. We'll usually get up to that number, and then usually you can come back to the neck in the future as well.
We'll see how sleeping goes tonight. There's some rules for that, and whatnot. I'm not worried about it other than me doing something stupid, like rolling over funky or something, but I'll just pay attention to that.
The biggest thing is to not disrupt the grafts, and it seems obvious, right? Like, well, don't mess with the grafts, but we're all prone to touching our faces and our heads during the day, so you have to be super careful to keep the arms down and try not to touch. That's really the key. Everything else usually works out fine. If you forget to spray a little bit, if you bend over a little bit, a lot of this stuff is totally fine. Most of the outcome is determined by how well the actual surgery was performed, and less so by how many times you've sprayed post-operatively. But if you rub the grafts out accidentally or bump your head on something, well, now of course there will be no growth in those areas.
It'll be fine.
Yeah, well, I think it looks like a job well done. And then tomorrow you go in for a cleaning, right?
Yep, they actually messaged me with my next appointment before I was out of the parking lot. So, okay. Yeah, I'll go in tomorrow.
I think I got that text.
We give instructions to patients for how to properly care for the recipient and the donor area, and it's really not necessary to come back the next day for cleaning, is what we found, because our patients heal well. But surely some clinics will still offer this service where patients can come back and they get cleaned up, and I think that's fine too. It's just important to keep in mind that based on my clinical experience, that is not a necessary step, and that you could get enough instruction to just take care of it on your own post-operatively, and then of course to talk to the clinic or call a doctor if there are any issues, if you have any questions. We have our post-op instructions in a form of a video on YouTube, so make sure to check those out if you're curious about what instructions we give to patients after their hair transplant surgeries.
Well, I'm excited to see how it looks after the cleaning and once it starts scabbing over and stuff. But I think it looks great, man.
Yeah, thank you. I think so too. I'm very excited. It was a good experience.
Cool.
Yeah. Absolutely.
The one tip I did give Ryan before the trip was to invest in a nice neck pillow.
Big fan of the neck pillow. I think it's great to sleep using the neck pillow for at least 3 nights after surgery.
Yeah, we stopped at nothing, baby.
All right, day after the transplant, how you feeling?
Feeling good. I mean, it's obviously a little bit swollen, but it doesn't hurt It's just, I look like Megamind.
Remember that the swelling will peak around day 2, 3 after the surgery. So the day after it might not seem too bad, but then some of that swelling is going to descend down and it might make your eyes more puffy or your cheeks puffier, and that's totally normal. The swelling will dissipate by about day 6, 7.
You know, what are you going to do? But yeah, feel good.
How'd you sleep?
I slept like a rock, really. I'm good at sleeping. I woke up a couple times, but part of that is because I've been trying to follow their directions and drink an excessive amount of water.
Yeah.
We don't tell patients to drink an excessive amount of water. Pretty much just regular diet after surgery. The only thing would be to avoid really spicy food because that can thin the blood and then you might have a little bit more oozing from the back. And then also to avoid very salty foods because that can increase the amount of swelling that you have, especially dropping down the face.
So now we're heading back to the clinic, and Ryan's going to get cleaning and I think a laser treatment to kind of help lock in the new follicles.
So the laser is not really going to lock in follicles. The follicles are locked in right after the surgery. So with the actual, blood drying around the follicles, once they're in their sites, they're pretty much locked in. And they go in pretty deep, right? So they're in usually about 5-6 millimeters, like under the skin, which might not sound like a lot, but in relative terms, when the scalp is maybe about a centimeter in thickness, like it's fairly deep. It's more than 50% into, towards the bone of the actual skull. So they're in there and they're only going to come out if you've, physically like push them out or if you bump your head on something and that friction pulls them out. So the laser might help with some general wound healing, but it's not going to make or break the result. In clinics that know what they're doing, like I'm sure this one, like ours, the survival rates from FUE surgery are very high, something like 96, 97%. So to think that a laser is going to bump it up even higher, that hasn't been borne out in the literature. And some people are doing cryotherapy to try to do something afterwards. But the truth is you really don't need that stuff. You just need good, sound surgery and just basic prevention afterwards so that you're not, pulling the hairs out and then things tend to just grow.
Ryan getting his red light laser therapy.
The laser therapy helps to accelerate the healing process and to strengthen and consolidate the hair follicles by promoting blood circulation.
Yeah, usually these types of treatments like red light, they require multiple sessions, to really see impact rather than just like one-time treatment the day after surgery. But, if they have the technology, kind of like a why not, I think it's okay. I don't think it's going to hurt him.
So they just showed Ryan how to take care of his hair and clean it, and then they hooked him up with this box with the hair repair shampoo, food supplement, and hair super serum in a cool little box.
Our patients get our Feel Confident Thickening Shampoo, our conditioner, and our thickening foam. And I remind patients not to use those in the first 2 weeks after their procedure. In the first 2 weeks, you just want to be using some very gentle shampoo, like baby shampoo. After 2 weeks, they start up on our products to make sure that their hair is as strong and as healthy as possible.
A week later, I called Ryan to check in on how everything was going. All right, so we are back with Ryan. It's been about exactly 1 week since the procedure. How's everything going?
Really good, really good. It's a little bit itchy.
For the itchiness, you can sometimes use Benadryl, but if you're going to be taking it by mouth, then you have to be careful because during the day it might make you drowsy. So it's something good to take at night. And during the day, at least I would give it 2 weeks. You can start to apply some topical Benadryl as well.
Yeah, it was a little swollen, a little bruisey for a couple days, and now I'm just following the directions and healing up.
Some people ask me, like, how will I look a week after surgery, a month after surgery, 3 months? So we have a patient, Max, who actually documented his entire post-op journey, and we released that video to YouTube recently. So make sure to check that one out if you want to see how someone looks at every single stage after their hair transplant.
It looked like your swelling wasn't even that bad. It definitely wasn't as bad as mine was. So
yeah,
maybe
I wasn't unrecognizable or anything.
Yeah, swelling is going to be variable. Some people get it really bad where, like, I've had some patients where the eye, like, completely swells shut. That's a minority of patients. That's quite rare. And other patients where there's literally no swelling down the face. So it's going to vary from person to person.
That's probably because you had the different method, the DHI, whereas I had the FUE. So
No, okay, so this is the misleading part, and I know Brett's not doing this on purpose because he's an honest guy and is just trying to tell people about these procedures. FUE refers to the donor method of harvesting, and DHI refers to the recipient area implantation method. Those are two sort of unrelated concepts. Also, there's no evidence to support that there's less swelling, less facial swelling from the use of DHI for implantation versus pre-made sites with placing grafts into those sites. So let's just be clear about that. There's no data to support one method being better than another when it comes to implantation of the grafts.
when will you be able to take actual showers and
They said 2 week. Well, hot water, high pressure wash is like a month. It's like 15 days.
So we tell patients after 6 days they are free to shower with the water current hitting their heads as it does normally. And we have not seen any issues related to that recommendation, and that's how I was taught. And my mentor has 30 years of experience in this field, so it clearly works with just letting the shower water hit your scalp as early as day 6 after your surgery. But it's always best to just listen to your surgeon, and everyone's going to have slightly different recommendations for what they recommend in their clinic. So there's nothing wrong with waiting longer, but just realize that it's typically very safe to start before, let's say, a month goes by to be able to wash your head normally.
And how's the front going? Has scabs started coming off on the front yet?
Yeah. I feel like it's almost all gone on this side. There's a little bit left here, and then a little concentration like right in the front. But I mean, yeah, slowly but surely everything's coming off, and it's looking, from what I see underneath, it looks good underneath. So
Awesome.
For most patients, by about day 10, the scabs are off. But that's assuming that you're following instructions. I've had some patients where at 3 weeks, when I do a follow-up call with them, it looks to me like all the scabs are there, and I ask them like why they're there, and they're like, well, I haven't touched the area, so that's not good, So you hope that that's very rare for patients of mine not to follow the instructions, but occasionally it comes up. So you want people really following and reading the instructions, and we reiterate that a million times on the day of the surgery and post-op as well. But some people will still do their own thing.
Well, the quality's not the best on here, so you'll have to send me some pictures that I could put on the screen for everybody to see. But that's definitely an exciting feeling when you see the scabs come off. And is there little hairs poking through? Or?
Yeah, totally. It's pretty cool.
Awesome. Cool. That's awesome. I think around week 2, all the scabs should be gone. So
yeah, he's right about that. That's our recommendation as well.
Yeah, that's
Hopefully that's the case. But for me, it wasn't the case. I had to actually go in there with a toothbrush and gently scrub the scabs off because they were so thick.
Yeah, that's unusual, but yeah, it's interesting.
I don't think that'll be the case for you, so that's good.
I don't think so either. It seems to be coming along pretty well so far. So yeah.
For me, for maybe like 3 or 4 days, I would wake up and there would be some like oil and a little bit of blood on my pillow from the back of my head. Was that happening to you too? Or
that happened in Istanbul after the procedure, but it hasn't been happening since.
Okay.
I haven't. Well, I mean, I've been putting a towel down on my pillow, but I haven't noticed anything.
Yeah, usually the spottiness we see for the first day or 2 from the donor area, and then it just dries up.
Cool, man. Let me think if there's anything else. You've been trying to stay out of the sun, wearing your little hat.
Yep, 100%.
Yep, and
following all the rules.
Awesome, man. Glad to hear it.
Yeah, after a hair transplant surgery, the skin is quite delicate. You'll see it's going to be pink for usually a few months. And during that time, you're more susceptible to, for example, burning your skin, right, from the sun. So you definitely want to be very careful with the amount of sun exposure. And after a few weeks, you can start with some sunscreen protection, and then also just wearing hats and avoiding direct sun exposure until that pink quality of the skin goes away.
And then around 3 weeks, you can start exercising again.
Our patients start light exercise after 1 week. They start regular exercise at 2 2 weeks, and things like swimming and sauna, we usually recommend waiting 3 weeks.
1 month you can be out in the sun, I think. What's the case? Yeah.
2 months for sun exposure, but no big deal. I look good in hats. So.
But even at 2 months, if your skin is pink, you should be very careful.
Well, I think it's looking great, man. We'll be sure to check back here in a month or so when all the scabs are gone and the new hairs are coming in. But yeah, man, I'm excited to see the results.
Thank you, Brett and Ryan, for being so open about your hair transplant journeys. It's never easy to tell people about this process and to be vulnerable about wanting to get this done and going through it and displaying it, for everyone to see, for the whole world to see. So my hat goes off to you guys. And yeah, looking forward to seeing how things look in about a year.